The radiation oncology residency program at UT Health San Antonio is a strong, clinical, innovative program. We provide a clinical environment with an enormous breadth of patient experience. We see the most complex, the most interesting cases all throughout Southern Texas.
Here at the Cancer Center, we have a wide variety of not only complex and interesting cases throughout a whole spectrum of disease sites, but also a wide array of patients from all different sorts of backgrounds. Residents that come through our program go on 3-month rotations with individual faculty, and the faculty will serve as their mentors as they learn that disease site. And so it's a one-to-one resident to faculty rotation. And I think that by having an extended period of time with an individual faculty, residents come away with a better appreciation for that disease site.
What I like to see and what we try to cultivate is that you have a sense that these are your patients, that you're their doctor, and they come to you first.
I work up every patient. I get to see them at consult, at every weekly check, at their follow-ups. I go through their plan entirely with them. And, while the attending, and I have a lot of support here to help us, while the attending agrees with the plan, I know these patients in and out, and they feel comfortable with that plan because I have built that relationship with them. It's really nice to have that ownership of those patients and, feel like I am taking care of them through their cancer treatment.
And so getting that really focused attention on the one oncologic site has helped me to really focus my studies, to get repeated practice at coming up with a plan, with doing contours for that site. And then also having the rotation for 3 months, again, gives me that opportunity to see patients from consultation to completion of treatment and follow-up.
So at its foundation, we are a clinical training program, and that's our goal, is to make great radiation oncologists. But we also want to offer for individuals who are interested in an academic career, those opportunities as well.
At Mays Cancer Center, we're blessed to have a really great team and a really great space. And we actually have a lot of room not only to take care of our patients, but extra vaults to conduct research and unique treatments tailored to the individual patients that we have. And then not only just the physical space, but the team that we've assembled here at Mays Cancer Center, not only just on the medical residence side, but throughout the Department of Physics and Dosimetry, we have a number of learners throughout the department that really foster an environment for innovation that I think is really unique to our cancer center.
One of the really nice things about UT Health San Antonio is their very robust brachytherapy program, specifically in the gynecologic cancers. They do a tremendous number of tandem and ovoid procedures. I myself had done well over 100 of those by the time that I graduated.
One unique aspect of the program is our partnership with MD Anderson. On a weekly basis, we get to review our cases with them that we plan with our attendings, and we get to review it with their attendings as well. And we also have access with clinical trials there, which is very important for our patients. So from both ends, it's very unique for us to get input from another center like MD Anderson in order to get a different perspective, and that's very important for our training.
I gained a much better understanding of radiation, not only from the attendings that are physically present at UT Health San Antonio, but also through some of the MD Anderson affiliations. They really gave you access to everything to make you feel that you could learn or do whatever you set your mind to.
So whether as a resident you come through here and you end up going into basic science or translational research or into clinic and private practice, a strong clinical foundation is key to your education.
We're really excited here at UT Health San Antonio Mays Cancer Center that we have a wonderful opportunity to bring new innovative technologies to the people of San Antonio and the greater Rio Grande Valley. We've just now started a very robust interstitial high-dose rate brachytherapy program, and this will be expanding over the next year or so to include more indications as well as more and more patients. We anticipate the opening of our proton facility in mid-2023, which is very exciting. This will come with it a great amount of research opportunity, some research funding, as well as a great clinical experience. We anticipate an MR Linac installed somewhere in the next 2 years. This will be the latest, greatest in image-guided radiation, and it'll be very exciting as Many of our patients live distant and down in the Rio Grande Valley, and so the ability to treat with SBRT in a hypofractionated way will be a tremendous value to these patients. We now have approval by the Board of Regents of the University of Texas to build a new hospital here in San Antonio, right across from the radiation department actually, that will be focusing in oncology. So it's very exciting times to be here at UT Health San Antonio.
You know, when I look at people who get into radiation oncology, I really look for people that are passionate about the field and get into it for the right reasons. And so we're looking for people that truly have a passion for radiation oncology, have a love for taking care of oncology patients and cancer patients. And it's a unique person that wants to dedicate their life to that field, and that's the sort of person that we're looking for. With the diverse population that we see, the number of extremely rare and unusual and fascinating cases, with the new technologies that we have already in our clinic and the ones that we're going to be bringing on board, the sky is the limit in terms of what you're going to be able to experience here as a resident.